Hi everyone, I am Kimberly, the 5-Minute NP. The 5-Minute NP was born out of my belief that small, incremental changes can drastically change the trajectory of your life. Our genes do not have to determine our lifespan. My goal through this podcast is to act as a roadmap that bridges the gap between knowledge and action, leading to you living your healthiest, happiest, longest life. Welcome to the 5-Minute NP podcast. Hello everyone, welcome to this episode. I was honored to interview Dr. Saray Stancic. Dr. Stancic is triple board certified in internal medicine, infectious disease, and lifestyle medicine. She is founder of one of the nation's first lifestyle medicine practices. She is also the producer of the film Code Blue, which reveals insufficiencies currently found in the field of medicine, as well as how lifestyle medicine is a powerful tool to prevent, treat, and even reverse chronic disease. Code Blue was born from Dr. Stancic's personal story of living with multiple sclerosis and how switching to a whole food, plant-based diet and changing her lifestyle gave her life back, and she has lived symptom-free for 25 years now. Her story is not only inspirational, but it speaks to the power of food as medicine. She shares life-changing information that we all need to hear. So welcome to this episode of the 5-Minute NP podcast. Welcome, Dr. Stancic. Thank you for being here today.
Thank you so much for inviting me. It's really a great pleasure to be part of your podcast. And I'm so excited to learn about you and the important work that you're doing and all this passion that I see that you have in spreading the good word. So thank you for that.
Well, awesome. Awesome. Code Blue and the completion of your first book. I mean, you've been busy.
I sure have. It's been a marathon for sure, but it's an exciting time. I more than ever am excited about this idea of this movement in the field of medicine that is going to create some significant change in how we practice medicine moving forward. And I think I've never been as optimistic as I am today. Obviously, we're dealing with some challenges in medicine today, in healthcare, with the pandemic, which has, I think, interestingly, in many ways, intersected with the chronic disease epidemic. And by that, I mean, we know that those who are infected with coronavirus, if they have a pre-existing chronic disease, they are 6 times more likely to be hospitalized and 12 times more likely to die. So I think that these are not two separate healthcare issues or challenges that we're facing, but I think if anything, what the pandemic has done has shined a big bright light on how vulnerable we are. And if anything, I hope the silver lining in all of this pain and suffering that we've experienced this year with this pandemic is that it leads to a sweeping urgency and a need that we as healthcare professionals need to bring change and awareness to this idea that 50% of Americans are regrettably living with a chronic disease. 42% of Americans are obese, Kim, which is striking. You know, last year, so I've been writing the book over, I guess, 15, 18 months, but last year around this time, I wrote the section on obesity for the book. And at the time when I was doing my research, the CDC was reporting that obesity rates, at that time, 39.8%. Today, the most recent CDC rates are reported at 42.4%. That means in 1 year, we increased our obesity rate by 2.6%, which is hard to. So I think what that speaks to is the fact that we are not plateauing here. This obesity epidemic is ever increasing. This chronic disease epidemic is ever increasing. In fact, the CDC just recently reported that, you know, every year they offer us the top 10 leading causes of death, and they reported that 7 of the top 10 increased this year compared to last year. So again, this idea that even though it's bad, it has not yet plateaued, and it continues to increase despite all of the advances in clinical medicine, all the medications that have been approved by the FDA to treat chronic diseases like diabetes and heart disease. We still are meeting incredible challenges. And whatever we're doing in medicine is falling short. There are still areas in which we need to improve. And when we know, the scientific literature tells us clearly that 80% of chronic diseases are preventable by modifying our behaviors, that is the most important therapeutic intervention we have available to us. And we have to speak to this loud and clear so that it is received. This message is empowering message is received by our communities and importantly by our healthcare professionals, because we all need to, in every corner of our country, speak to this together so our voices coalesce, so it's heard by the general public.
You are so right. And I also have heard you talk about, as a healthcare provider, the importance of being a role model. I mean, they need to come to us and see us practicing what we're preaching.
That is so important. And a lot of that work was illustrated by research that Erica Frank did, where it's important that as physicians and as healthcare professionals that we exhibit those very same behaviors that we expect or ask of our patients, so that we are actively moving. So I often will ride my bike to my office, or my patients will see me walking into my office. Taking opportunities during the day to include some physical activity in the middle of my workday, or they'll see me at the supermarket. What's in my grocery basket? It's all the foods that we talk about. So being that example, even the environment in which you practice, is your office setting conducive or reflective of the principles of lifestyle medicine? Do you have donuts in your break room? Yeah, these are simple things. So we want not only our physicians to practice this way, but we want the environment to reflect it as well. And I think it really means a lot, and it conveys an important message to our patients when we're exhibiting those all-important behaviors. It carries a lot of weight.
Mm-hmm. I think that with all the knowledge that we have, the scientific evidence that we have, you know, it's like anything. We have the knowledge, but I think what changed in my life is when I made the decision to change my lifestyle, change my diet. And I think that's where it has to start. You have to recognize it and make the decision to start, and then just start managing it daily. I mean, it's a daily choice. And you have the choice, and that's why I can't wait to hear your story and share it with others, because you made the choice and then you integrated that lifestyle, not just diet, but exercise, and everything about you was changing and you were getting better.
Right. And I think that's a great point. It's not just diet, right? We can be because some folks can be really good at diet or really good at exercise, but then they're not sleeping, they're drinking too much, they're highly stressed. So I refer to it, Kim, as a lifestyle medicine wheel, and there's 6 spokes on that wheel, right? And we want to address every spoke on that wheel, because if you had a couple of spokes working quite well and the other ones were sort of weak, your ride would be sort of wonky, wouldn't it? You wouldn't move forward very effectively. So for me, it's, and I describe this in the book as the sweet spot. Let's address every aspect of your lifestyle simultaneously. Now, I think it's also important that we meet patients where they are. Mm-hmm. The expectation is not that you change everything overnight, but that at least we're planting seeds. We're introducing concepts of small changes, because small changes lead to great leaps and bounds. So I think we have to understand that patients, each patient that comes into my office is in a different place, and I respect where they are. And we meet them there and we support them. And it could be something as small as, I'm going to take a 5-minute walk today, and I haven't done that in years, but value that. That's something to celebrate. If you can consistently just get that movement in and commit to do it daily, then that's great. Or if you can implement one change to your diet, I'm going to cut out the bacon in the morning, and instead I'm gonna add a bowl of fresh fruit. I'm willing to do that. Yay, then let's celebrate that. Sometimes I think we might expect patients to change everything overnight, and when we do that and consider anything less than that a failure, then that's a mistake, and it often leads to regression. So I think any step forward that we can make, not only for ourselves, but for our patients is going to be beneficial long term.
I so agree. I'm all about small changes because it's true. They will compound on themselves, and you will start to feel better, more confident, and then you'll just start choosing those things without even realizing it. You're reaching for the healthier stuff. You're making better choices, all because you took the first few steps each day to make those choices. Well, let's dive into your story. I know back in, was it 2003? Is that the year you were diagnosed?
1995.
1995. Okay. So you were hit with quite a blow when you received a diagnosis of MS. Can you take us back to that day? What happened?
Sure. So it was October 11th, 1995, and I was a third-year medical resident and on call at the hospital. And it was a really busy night. And around sometime in the mid-morning hours, I finally had an opportunity to take a nap. And when I was paged shortly after that, falling asleep to care for a patient matter, I couldn't feel my legs. And it happened that abruptly, that acutely. And it was daunting I had no idea what was happening. A million and one things were running through my head. Next thing I knew, I was in the emergency room. An MRI was conducted looking at my brain and spinal cord, and those studies confirmed a diagnosis of multiple sclerosis with multiple lesions. So I had a significant burden of disease even at that point early on in both my brain and spinal cord. And you know, when I look back retrospectively, there were certainly symptoms or signs that something wasn't right, but because I was a medical resident and working hard to get through the challenges of training, and I just worked right through them, and probably it took, obviously it all came to a head in that moment. And so with that diagnosis came, as you said, a significant blow, because I had walked through those hospital doors, what I thought a vibrant, healthy young woman with her whole life ahead of her. Mm-hmm. And all of a sudden, I was being painted a very different picture, in that my doctors told me that it was likely that I would be in a wheelchair within 10 to 20 years, and how I had to plan ahead moving forward. And this was not part of my expectation at the time. I had just worked really hard to achieve my dream to become a physician, and I had many dreams and expectations of what life would be like moving forward, and all of a sudden the floor had been pulled out from under me. And so it was not only physically distressing, but also emotionally a challenge, just having to accept where I was and recreating what my future would look like.
Right. Also a humbling experience, going from one minute you're the doctor, you're making the diagnosis, you're treating the patients, and suddenly you're in a very vulnerable position, now being the patient and just trying to figure out what's going to happen to you. I mean, and the scary thing is that you knew that what MS was, you understand what it involved, and this was no light thing. This is something that you were going to have to deal with the rest of your life.
Right. So I knew, obviously, as a physician, that MS was not something that we could cure, that this was a chronic, disabling autoimmune disorder. And obviously, as a physician, I had cared for MS patients and seen end-stage sequelae of this disorder. And I immediately knew, it hit me like a ton of bricks. I knew what this meant, and it was a frightening experience.
How did from the time you got diagnosis, how did you progress with the illness throughout the next few years?
So immediately after, so that event when I was first hospitalized was what we call an exacerbation, as you know, in the field of MS, and that's typically treated with IV steroids. So I underwent that treatment and then physical therapy to get me up and moving again. And so once I was through that initial event, I was in, at the time, the FDA had just approved the first drug in the MS realm that treated or slowed the progression of MS. So we can't cure MS, but we do have, at this point, several medications that are used to slow the progression. But at that time, there was only one. And so the drug that I was started on is called beta-seron, and it was an injectable interferon drug every day. And it had a significant side effect profile that included, I often go through this long laundry list, but essentially a flu-like illness, nausea, insomnia. It can cause depression, suicidal thoughts. It's a real injection site reactions, which can be very painful. And at some point, you run out of real estate, Kim. You know what I mean? After your legs and your abdomen and your arms. At some point, if you're injecting every day, you run out of space. So I had these nodules, these painful nodules all over my body, and despite all of these this medication. Over the years that followed, the disease progressed, and I found myself not only on the medication to slow the progression of the disease, but also other medications to treat other symptoms and also to treat the side effects of this medication. So by 2003, I was dependent on a dozen drugs. I always carried a pill box with me, and at that point, largely dependent on a cane or crutches. And so I was really, I have to say, largely had at that point lost hope that things were going to get better. I think I was a very sad young woman, largely depressed. I was on Prozac or whatever antidepressant my physicians had prescribed at the time. And so I was just getting by. And then in 2003 was when I came across literature by chance that discussed the connection between diet and multiple sclerosis. And that to me was like earth shattering. I was like, what? Yeah. I was like, I couldn't believe what I was reading. And there was a particular article published in the New England Journal of Medicine, believe it or not, in 1952 by a physician named Dr. Roy Swank. And in this publication, Swank writes about the incidence of MS in Norway. And Norway, by the way, has one of the highest rates of MS in the world. But he speaks about what's happening in Norway, and he notes that the highest rates of MS are occurring in the inner farming dairy communities where they're consuming great amounts of saturated fat. And he hypothesized back in the 1950s that saturated fat was somehow playing a role in pathogenesis of multiple sclerosis. And so with that knowledge in mind, Dr. Swank decided that he would indeed treat MS patients with a low-fat plant-based diet. Now, obviously, this is before any medications were available. And so he started to treat, and he had a cohort of 140 plus patients which he managed with this low-fat plant-based diet over, believe it or not, 34 years. Wow. And ultimately, he reported his findings in the journal The Lancet in 1990, and he concluded that in those patients who had consistently maintained his recommendations, the low-fat plant-based diet, that they largely had significantly less morbidity and mortality, and 95% of them remained disability-free. Wow. And that to me was truly striking. Disability, because every time I went to my doctor, he reminded me of the wheelchair. I was terrified of being disabled and being dependent and committed to long-term care. So when I read these words, 95% remain physically active, that truly resonated with me, and I wanted to learn more about Dr. Swank and his approach. But it wasn't just Dr. Swank in 2003 when I was sort of tickled by this evidence that led to my insatiable appetite to delve into the literature and learn as much as I could about not only diet, but also lifestyle and its effects on human health. There was ample evidence in literature from multiple arenas, multiple countries that were producing literature that spoke to the importance of diet and lifestyle in not only reducing risk of multiple sclerosis, but also better improving outcomes. I learned how the effects of smoking and excess weight and lack of exercise in risk and worsening of MS outcomes. Again, all of these lifestyle behaviors are so important. And again, that weren't relayed to me as of importance when I saw my physicians. These were topics that were not addressed during a typical visit with an MS specialist. So the visit was always centered around the disease-modifying therapy. And so as I gained more and more insight, I came to the understanding that clearly I needed to implement changes in my life. And so in 2003, I made the unconventional decision, and this, of course, was not supported by my physicians, who were disappointed that I had made this decision, that I was going to responsibly taper off of the medications that I had been taking for 8 years with little, at least in my case, little value in that I seemingly wasn't getting better. And I decided to optimize every aspect of my lifestyle instead. So it was a big, bold decision, a scary one. Yeah. But I had faith that it was going to bear fruit. So the first thing I did was I optimized my diet by adopting a whole foods, plant-based diet. And folks will say to me, well, why did you decide to do that? I decided to consume a whole foods, plant-based diet because the overwhelming body of evidence in the scientific literature pointed to a diet rich in fruits, vegetables, whole grains, legumes, nuts and seeds as being not the optimal diet for MS or for diabetes or for heart disease or for Alzheimer's, the optimal diet for all of us. Mm-hmm. We should all be consuming a primarily plant-based diet. I began to exercise, which was back in the 1990s, believe it or not, it was falsely believed to worsen MS outcomes. So I was largely advised not to exercise. So I began to exercise. And at that point, I was so deconditioned and largely disabled. So the only thing I could do safely was a treadmill, rather a stationary bike on which my husband would assist me to get on. I definitely couldn't do a treadmill because I would fall and stumble, but my husband would help me onto the bike. I could do a minute or two, and then exhausted and in pain, he would assist me off, and it would take 10 to 20 minutes to recover from that. But I was convinced that this was going to be my medicine. This was going to be my prescription. So the next day I got back on, and the day after that, and the day after that, and slowly over months, I started to improve and gain strength and stamina. I addressed the streams of stress in my life. I learned how to look at the world differently. The perspective that I had shifted. I created space in my life for meditation, for yoga. I made it clear to my team that I wasn't going to take on that extra research project. At this point, I was chief of infectious diseases at the VA, at the Hudson Valley VA in New York. And I brought my team together, letting them know that I was going to leave at a reasonable time and I wasn't going to overextend myself. That for the first time, I was really, truly going to put myself first, which is what we should all be doing, by the way.
Right, right.
And then one of the biggest lessons that maybe I don't often get to speak about was learning how to sleep properly. Sleep hygiene, understanding effective sleep physiology and what that meant. I didn't learn this in medical school. I was addicted to hypnotics like Ambien or Ativan, benzodiazepine that is often prescribed. And so I had to learn how to come off of those medications very carefully and how to create an effective sleep environment in my home and understand what good pre-sleep rituals are and understand the importance of their circadian rhythm and sleep structure. And when I did this, I learned how to sleep well, and that was truly life-changing. I call myself, I used to self-define myself as someone that lived with insomnia. And today I'm like a professional sleeper. I am so good at sleeping. I do it so well. And that's when I see patients and they want the biggest overarching lesson that they want to learn from me is how to eat properly. And I get it. Nutrition is really, really important, but I'm super excited about telling them how to sleep properly, because I think it's one of those lifestyle parameters that we tend to not pay a lot of attention to, and it is so, so important. Remember, it's all spokes on that lifestyle medicine wheel that we need to address, and we need to address them simultaneously, because that's when we reap the greatest benefit. So I learned how to sleep properly, and what happened over time was that I started to feel better. And I often say, this, and people sort of chuckle, but at first it was simple things like I could stay up past Jeopardy, which was like monumental for me. And then I found, as months passed by, that there were days where I felt confident enough not to leave my cane in the car and actually go into the office without a cane. Wow. And then the one day that I speak about often, because I'm often asked, how long did it take before you knew that you had made the right decision? There's one day that I often speak of, and I share in the film. I share this day. It's July 2nd, 2005, which is about 2 years after my lifestyle change. And the reason I remember that day is because I attended a wedding, and at that wedding I did two things that I hadn't done in a long time. And of course, it sounds silly and maybe trivial, but I wore heels and I danced with my husband, which was, wow. I felt like I had just, won lotto. It was just, these are simple things that we often take for granted, but they meant a whole lot to me. But these were all signs that things were going in the right direction. And at this point, I was medication free. Every month and year that passed by, and by the way, I have to be fully transparent in that it wasn't always perfect. There were challenges. I never say that I'm cured. I still live with multiple sclerosis. So each day I enact all these behaviors. I don't do this sometimes, I do it all the time. And I'm very respectful of this disease, that I could wake up tomorrow and have a challenge. And so I want to be fully transparent, but as the years followed and the months and years followed, I just gained more and more understanding, and gained more and more strength and empowerment. And 7 years since 2003 and 2010, I ran a marathon, which was a momentous experience. It was crossing that finish line with my family there, was probably one of the most exciting moments in my life, not because I ran a marathon, but because it certainly illustrated that the changes that I had made in my life had borne fruit. And I'm forever grateful. And here we are, 2020. It's been now, more than 17 years since I implemented those changes. And each day I feel stronger. I just spoke to another, I just did an interview, and the individual asked me, what is your health like today compared to what it was back when you were diagnosed, the day before you were diagnosed, before you learned you had multiple sclerosis? And I'm so much healthier today than I was when I was 27 years old, because the understanding that I have today is profound as to how these lifestyle factors affect health and well-being. And so now in my 50s, I feel incredibly healthy, well, and luckily today, as I speak to you, I'm symptom-free, medication-free, and empowered more than ever before to share this healing message with whomever is willing to hear it, because I think it's life-changing. And the goal here is for all of us to age gracefully, to maybe at age 95 or maybe 102, spend a beautiful day with our family and friends, and then go to bed and not wake up. That's the happy ending I want for all of us, right? I don't want that. And you know this as a clinician, you know the typical story we see today in the United States, that end stage, that bookend, where we're living in a nursing home, demented, contracted, suffering with the sequelae of chronic disease. And we have the knowledge and understanding today to largely prevent that. I want to empty out those nursing homes as best we can, so that we can all age gracefully and not suffer those endpoints.
Yeah, you've definitely shown the power of food as medicine and lifestyle changes, that although MS is not curable, it's definitely manageable. Your quality of life has improved. And I think it's important to realize, people that have a chronic diseases, it's like you can empower yourself, make positive changes so that you're no longer a person with MS, a person with this. Now you're in charge, you're in control, and you should feel empowered that you can use these things to improve your own quality of life. And that's what everybody wants, right? I mean, you want to have a good quality of life.
Right. That's what it's all about, right? Nobody wants to have an existence where they're suffering and pain or dependent on multiple medications. And of course, every medication has a side effect profile. So the more medications you're on, the more likely that you're going to experience side effects. I think it's important that this is a good opportunity for us to make this point that in large part, the general public, and actually it's not just the general public, it's physicians and healthcare professionals, we have been trained with this understanding largely that genes are paramount, right? Mm-hmm. So many of us believe that my father had diabetes, his father had diabetes, so it's inevitable that I too will have diabetes. And what we've learned is that, of course, that's not true. That, of course, genes do play a role, but don't kid yourself and don't let anyone convince you otherwise. Lifestyle matters most, right? Mm-hmm. And the science of epigenetics has spoken to that clearly, meaning that just because we have a genetic predisposition to something doesn't necessarily mean that that gene will be expressed. That's the difference between genotype and phenotype, mm-hmm. right? And we know that gene expression is dependent on outside variables. And that's what epigenetics tells us, right? That outside variables that either turn genes on or off are those aspects of lifestyle that we've just been describing. What are you eating? Are you moving every day? Are you managing your stress? Are you sleeping effectively? Let's talk about substance abuse issues, how they affect you. And importantly, this notion or understanding of social connectedness. We know that those of us who are isolated or depressed are more likely to develop a chronic disease, are more likely to die prematurely. So let's not undervalue the importance of those social connections that are incredibly important in regards to personal health outcomes.
Oh, you're so right. I wanted to talk with you a little bit about this experience that you've had totally changed your path from your, the whole trajectory of your future from going through this. You totally switched fields of medicine and went, a totally different path. So can you talk a little bit about what lifestyle medicine, how is it different from conventional medicine?
Yeah. Great question. So, I began my career as an infectious disease physician. I went to school in Newark, New Jersey, and during the height of the HIV epidemic. And so I witnessed so much pain and suffering, and I wanted to be part of that solution. So I pursued infectious diseases, and I practiced as such for the first near 15 years of my career. And then in 2005, this is around the time that I had really implemented those great changes and I was feeling great. The VA brought on a program called the MOVE program, which was lifestyle medicine-like. And so when they came to my facility, I'm the chief of infectious diseases, but I raised my hand and I'm like, I want to be part of that. So I was the director of that program. And I started to, for the first time, implement and use these tools that I had used in my own life with patients. So we started walking with patients at the VA at lunchtime on our beautiful campus along the Hudson River. We started to talk about diet and stress, and I saw veterans who were suffering with chronic diseases like diabetes, like depression, reduced dependency on pharmaceutical agents. I saw them losing weight. I saw their mood changing. There was an elevated sense of more hope on the campus and those that participated in the program. And I saw the value. Mm-hmm. I saw it translate from this works for me, it works for my community, it works in patient care. And so that was exciting for me, but how was I going to transition from this infectious diseases expert and researcher in HIV and hepatitis? How was I going to leap from that to this idea of preventive medicine or lifestyle medicine? And it took me some time, but in 2012, I came to the point where I had contributed significantly to my field and I loved the work that I was doing. And of course it was all important, but I felt it came to this point where I said to myself, I can't go to my deathbed knowing what I know and not speaking to it like in voluminous fashion, meaning I had to really change everything I was doing. So I decided in 2012 to leave behind the work in infectious diseases, open one of the first lifestyle medicine practices in the country. No one knew what it was. People questioned, how could I do this? How could I leave behind a successful career in infectious diseases and commit to this? But I felt I had to do it. It was a calling. So I started the practice, and it wasn't just seeing patients in clinical practice, but also acknowledging that I needed to bring attention to the fact that there was a huge lapse in medical education, and how could I serve the next generation of physicians. So I volunteered at our medical school, bringing lifestyle medicine to Rutgers, New Jersey Medical School from where I come, mentoring them and supporting them. Reaching out to community beyond my practice, offering lectures in local libraries or churches to bring attention to lifestyle medicine. So you asked, how is lifestyle medicine different than internal medicine or mainstream conventional medicine? It is different only in the sense that it brings something that is missing to internal medicine. Now, it's really important for me to state this. It is not alternative, is not holistic. I don't like the terms integrative medicine or functional medicine because they mean something else, with all due respect. So what I do is, of course, I use medication as needed. I practice mainstream evidence-based, aligned with practice guidelines as any other physician would, but with an emphasis on prevention. Educating my patients that yes, you may have diabetes today, but you don't, this is a disease that can be better managed. You can reduce your dependency on medication, and you can even reverse the diabetic state. And let me show you how. Let me help you to understand how these aspects of lifestyle can improve your outcomes. And so that's what I do, helping patients to understand that every aspect of lifestyle plays a role in every chronic disease, right? It's not just diabetes, it's not just obesity or heart disease, it's also autoimmune diseases that are so commonplace, not just MS, but rheumatoid arthritis, lupus, ulcerative colitis, so many of these diseases that we see in clinical practice, dementia, Alzheimer's disease, stroke. These are all largely, again, they compose the top 10 causes of death in our country. And we know that these lifestyle behaviors can prevent them and largely ameliorate them. So the work that I do is not contrarian to or misaligned with conventional medicine. Conventional medicine has made extraordinary strides and advancements that are to be applauded. But what clinical medicine today has been negligent in is it has not placed any emphasis on the importance of lifestyle. And I believe that the medical education that we receive in medical school is incomplete. It is regrettable. It is borderline unethical that we don't convey these messages to our physicians in training. It should be the first lesson that we get when we walk through the door. It should be the foundation on which we build all else. Imagine if we had interventional cardiologists and the highest trained oncologists who are caring for the top 2 causes of death in our country, heart disease and cancer, who were also well-versed in the aspects of lifestyle. Imagine if you had an interventional cardiologist who could not only do your cardiac cath and your PCA, your angioplasty, but could also then talk to you or advise you on the aspects of bringing change to your diet and your lifestyle and how that might play a role in preventing that secondary event. Imagine if we had that. Cardiologists today get zero training on nutrition, and yet it is the one aspect where we have the most evidence that our nutrition and lifestyle is playing a key and important role in the development of heart disease. So that's a big missed opportunity. I think the good news is that more and more healthcare professionals across the country are becoming aware of this important lapse, and they're acting to change it. I receive email from physicians across the country just about every day, sharing their experience and how they're making changes. Last year, I spoke at a conference in Arizona at which physicians were in the audience. I had a physician who emailed me about a week after that, and we had Screen Code Blue at this conference, and he emailed me and said, look, I'm a 58-year-old cardiologist. I've been practicing medicine for 35 years. I train cardiology fellows, and attending this conference has changed everything.
Wow.
I'm 58, but I'm willing to learn. I'm going to join the American College of Lifestyle Medicine. I'm going to read, and guess what? I'm going to train my cardiology fellows to value this and assure that it is part of their curriculum moving forward. So it's those types of email that really invigorate me and excite me, and they're coming much more frequently. And we're seeing curricula change in medical schools across the country. As I said, right now, because of COVID and the pandemic, travel has been restricted, but we're still doing a lot of Zoom calls, and we're doing screenings. And later this evening, I'm doing a lecture for the incoming medical students at Rutgers, New Jersey Medical School. It's an introduction to lifestyle medicine. And so although I can't be there with them, we're still doing it. We're not allowing this pandemic to interrupt our ability to convey these important messages. So every day, I think the message is growing. I think you're a great example of somebody who recently became aware, and I can see your passion and your interest in pursuing this discipline and learning more and more and spreading the word. And you're doing this podcast. I thank you for inviting me to be part of it. But every day, and you'll see this, we're bringing more and more individuals into the fray, and everyone's excited. And I think one of the really great things about attending, and as I said, I've been practicing medicine for a long time, so I've attended a lot of conferences throughout the course of my career, infectious disease conferences and hepatology conferences, both here in the United States and in Europe. And I can tell you that none of those conferences offer what you experience when you go to the American College of Lifestyle Medicine conferences. And I'll say that not only do you get, obviously, a lot of education, a lot of really important lectures that are presented, and poster presentations and research that is being presented, but there's something about the environment at the American College of Lifestyle Medicine. You have a lot of excited, joyful, passionate clinicians that have a lot of energy and want to learn and convey. So we have like a 5K that we run during the conference. There's yoga. Even the food that we consume during this conference is plant-based. It's centered around not only being delicious, but also being healthy. And so you walk away, if you're new to this and you go to this conference, you walk away feeling invigorated, inspired. I think that's a common theme, that every time I attend this conference, I meet new people, and everybody's doing something in their part of the world. And I mean literally the world, because it's not just the US there are people from all over the world that come that attend this conference. Our last conference took place in Florida, in Orlando last year, and I think we had more than 2,000 in attendance, and I had the distinct honor of screening Code Blue at that conference. So it was like a dream come true, Kim, to sit in the back of that room and see all of my peers watching the film that I had worked on for 5 years, sitting beside my husband and my children, and it was truly a wonderful moment to do that, and then to be able to address the conference after with some Q&A. And I'm just so excited and proud of my colleagues and peers. I'm so grateful to the pioneers that have come before us, like Dean Ornish and Caldwell Esselstyn, Michael Greger, who's done important work with his website and his beautiful books that have disseminated them. He's a New York Times bestseller. David Katz, who ex-president, who's just an eloquent researcher and speaker, and he's doing so much to further the movement. And again, it's important for us to reach mainstream America, and important for us to invite our colleagues into the movement. And I think the future is bright for the field of medicine, because this is an ever-growing movement. I can tell you that the medical students, and if you've seen Code Blue, there are a couple of my medical students are featured in the film, particularly one young man, his name is Saul Batista. He's now, at the time he was a medical student, but he's now a second-year medical resident in South Carolina. And what's most exciting about all of this is that those medical students of the past are now the residents and attendings of the future. And they're setting an example for their students and their colleagues. So the word is spreading, and I can see Saul in a few years, he's in his residency, in a few years, I expect him to be the chief of medicine somewhere. And I can envision that his program is going to be all about lifestyle medicine. He's going to be, and he's the example. He's, you know, exercise is a big part of his existence, optimal nutrition. Again, he's exemplifying the principles of lifestyle medicine, and that's a very important and powerful example for not only patients, but also for his peers.
Yeah, it is so cool. I loved in Code Blue, the medical school that was integrating all of this stuff into their school. It was so cool. You could tell the difference in the students. They were excited, they were happy, and just so energetic. And when you think of medical school, I think you think of the grind and the all-nighter, you know, just all of this stuff. And so it was such a positive experience in this medical school.
Such a positive experience. If you remember, there's that one scene where we're in the kitchen cooking and they're all wearing chef hats, and you think it's like a culinary school. No, it's a medical school. But part of their training is culinary medicine. And yes, it's true. And thank you for relaying that, because I really wanted to convey this message that these kids are like happy. I mean, it's hard to find medical students that are happy, because, you know, regrettably, medical school is taxing, and depression is a problem, and even suicide is a big problem in medical school and in the field of medicine. And these kids are happy, they're joyful. They even said to me, you know, I didn't think medical school could be so much fun. And because I have to say, and I would love you to reach out to Dr. Jennifer Trook to maybe do an interview with her.
I would love to.
She's the brilliance behind this medical school. She had a wonderful forward-thinking and progressive dean. His name is Dean Yuki, who recognized that lifestyle medicine, or this foundation, was important. He, by the way, is now retired, but he practiced as a vascular surgeon, so he saw a lot of the sequelae of chronic disease and in clinical practice. So he knew that this was important, and he gave Dr. Trilk the tools to create this program, this curriculum. And Dr. Trilk has created a medical school that truly is joyful, that is conveying to these students all that every other medical school is offering, in that, yes, they're learning all these aspects of pathogenesis. I talk about medical school as being one that delivers an understanding of pathogenesis. And of course, pathogenesis is the study of disease and illness, which is what we learn in medical school, right? I call it, we become very good disease detectives. We collect clues, right? A good history of physical, we're collecting clues. We do labs, more clues, imaging, more clues. And then ultimately we use all of this information to make a diagnosis. And once we have that diagnosis, we then implement a plan, and that plan is typically a pharmaceutical agent, a procedure, or a surgical intervention, sometimes all three. Of course, that pathogenesis model is incredibly important and should be part of what you relay to students, and it should be part of their experience. But what's missing in medical school is the mirror image of pathogenesis, right? Which is what we call salutogenesis. Salutogenesis is the study of health and well-being. How do we prevent disease? How do we maintain and sustain wellness?
Right.
That is all missed in medical school.
Right.
That's the piece of what I call the human health continuum that is missed.
Mm-hmm.
And how is it that we become physicians, experts in health, delivering health care, and yet we learn nothing about health? We learn about sick care. That's what we're really good at.
Right.
It's only half the story. The other half is just as important and it needs to be equally balanced. And medical students need to walk away knowing that this is really, really important.
Mm-hmm.
Part of the Hippocratic Oath is prevention is preferable to cure.
Mm-hmm.
It really is. If we can prevent a disease, let's place a lot of emphasis on that. Let's put a lot of attention to this idea of prevention. If we do that, we can shift the paradigm. This chronic disease epidemic, we could turn it around, but it needs all medical schools to bring attention to it so that we create a new generation of physicians and healthcare professionals that are well-versed in the power that lies in lifestyle.
Well, I think people are confused. There is so much about diet and which type of diet. I know I've interviewed people about keto diet. I mean, even people I follow, are health, people that are, still eating the bacon and the meat and they're pushing that. And it's like, I don't understand it because you're right with the scientific literature. Everything. I was just comparing them the other day. I'm looking at Medscape. I'm looking at Up to Date. I'm looking at the New England Journal of Medicine. I'm comparing. I'm like, it's all pointing to a plant-based diet. And when you look at the American Cancer Society, it's saying cut back on red meat, processed meat, limit it in your diet. And so I think people are just confused as to what is best. I just think that people are confused. So I think it's important to understand the power behind the plant-based diet. I mean, what would you say that diet is so powerful? What is so powerful about the plant-based diet compared to some of the others?
Yeah, I think the reason it's so confusing is because there are so many variables in play, right? There's politics, there's special interests. Sometimes individuals will add in their subjective opinions. And I think that's where we have to be very careful. We have to look at the evidence objectively and interpret it objectively. Even in our own space, there are difference of opinions, right? There's no oil, there's strict vegan. So there's a lot of confusion. I understand that. So my job, now I may have subjectively, I may lean subjectively in certain areas, but objectively, when I'm wearing my Dr. Stancic hat and when I counsel patients and when I speak to this, I don't speak to anything outside of the evidence, right? So when we look at the evidence, like for example, let's talk about the diabetes prevention program, which is an important study that I think most physicians and healthcare professionals are well versed on. It was published in the New England Journal of Medicine in 2002 that showed in pre-diabetic patients randomized to either metformin, which is a drug that we routinely use as first-line agent in diabetes, versus diet and exercise, that diet and exercise was nearly twice as effective compared to metformin in regards to developing diabetes, which is wonderful. But in that study, it was not a vegan diet. Right? It was a diet that was primarily plant-based, right? So I think it's very important that although, I mean, I personally don't consume any animal sources, but that's not the way I advise my patients. What I advise them to do is to consume a plant-centered plate. So primarily plants. And if you can, it's all about, if you would, giving. In our country, we are animal-centric, right? If I asked you, what'd you eat for dinner, you would, not you, but someone who, a typical person, you ask them, I had the chicken, or I had the fish, or I had the steak. Nobody says I had the broccoli or the sweet potato, right? We don't talk like that. The vegetable or the plant is typically the side dish. It's the afterthought. So the first step that we need to take in our country is to bring attention, make the plant primary. Make your plate centered around the plant. So if you're going to have any animals on that plate, that they are the side dish. So what we want to do is slowly but surely creep the animal off the plate. Now, with that said, there are a lot of reasons why people adopt a vegan or a plant-based diet. Maybe for animal rights reasons or for environmental reasons, which are all legitimate and important. But that's not my realm. That's not my area of expertise. And that's not what drives me. I love plants and I love the environment, and I want to act in a way that is going to serve those areas. But that's my role as a physician and scientist, is to interpret the data, the research. And based on the research, what I've learned is that a diet rich in these plant-based foods, however it is that you're willing to define, because if you see a patient that's eating bacon and eggs for breakfast, a Big Mac for lunch, and an entire pizza for dinner, that's just getting that person to introduce any plants into their diet is a win, right? So again, it's about meeting the patient where you are. If you take that very patient, Kim, and you say to them, you got to be vegan and you got to be vegan tomorrow, you're going to lose them.
Right.
That doesn't happen. There has to be a period of transition. Now, there is the rare individual that can change things overnight. That's true, but it is unusual to have that happen. I think when we get sort of confused about what to eat, I think the most important message you can convey to an individual is eat primarily plants. And then we can fine tune as we go along. But this idea that it has to be no oil, or it has to be strictly vegan, or there are so many rules that potentially we can introduce that can often turn patients off or reduce the likelihood that we're going to bring more into the conversation. I think those recommendations can sometimes be put off patients. And what I want to do, and if you saw the film, I tried to avoid the word vegan, or I tried to avoid any terminology that made the viewer walk away with this idea that it's either my way or the highway. That's definitely not what I wanted to convey. Because we haven't done the clinical studies. Let's say in the diabetes prevention program, if they had added an arm with a strictly plant-based diet and exercise and compared that to the diet that they utilize, maybe the benefits would have been greater. I think they would have been. But that's my subjective opinion. And we don't, in medicine, advise patients or communities based on subjective evidence. We have to speak to the objective evidence. And so the objective evidence speaks to a diet that is primarily plant-based. And I think even the food guidelines that have been regrettably slow to speak to the evidence, and that's largely because of the politics and all the other variables that play a role in affecting what they actually put out to the American public. Even the guidelines, the food guidelines, have shifted largely to this understanding that plants need to be primarily on our plate, and really helping patients to understand that why eating these foods affect helping them understand that fiber is really the most important aspect of diet, not protein, which is what we were raised to believe.
Right. I was going to ask you that. Why is this, why is red meat and why is meat so bad for us in the first place? Because I don't think people really understand, why not? Why can't we eat it? What's it doing to us? I mean, is it affecting our microbiome? Is it, what's going on with it?
Yeah, well, it's doing a lot of things. Well, certainly meat is delivering protein, but it's also bringing a lot of baggage like saturated fat and cholesterol and heme iron. But I think importantly, let's speak about the microbiome, because this is a really hot topic in medicine right now. And there was an article published in the New England Journal of Medicine in 2013 that looked at phosphatidylcholine and how phosphatidylcholine, which is, by the way, in meat, dairy, and eggs, when you consume phosphatidylcholine, and how that affects the microbiome. So when you ingest these foods, as we're metabolizing this food, at the end of this process, the byproduct of that is something called TMAO, or trimethylamine N-oxide. So for those that are listening, you might want to Google that term, TMAO. But TMAO leads to atherosclerosis, so narrowing of the coronary arteries, leading to stroke, death, or heart disease, right? So this is a mechanism by which what you eat changes the bugs in your gut, and the bugs in your gut then produce a signal that leads to heart disease. Similarly, in the multiple sclerosis literature, we've learned that, again, you know, back when Swank in the 1950s said, what you put on your plate, these plants are somehow leading to better outcomes in multiple sclerosis. Everyone thought he was crazy. How can what you put on your plate affect a neurological disease, an autoimmune disease that's affecting your brain and spinal cord? There's no connection between your stomach and your brain. Yes, there is. And we've learned that recently. Literature published in the past several years has shown this. When we eat a fiber-rich diet, we change the bugs in our gut to favor the good bugs, right? And the good bugs then produce something called butyrate, a short-chain fatty acid, that then sends a signal to our immune system, our B cells and T cells, and tells it to quiet down and not do damage. So now we've learned through these mechanisms that what you put on your plate changes the bugs in your gut, and the bugs in your gut either communicate positive messages or negative messages. So, and this is just the tip of the iceberg. We're just beginning to understand these organisms and how they in fact affect health outcomes. But the specifics and the biochemistry and all the steps that we can get so marred and complicated, and all the different aspects. The bottom line is, it's simple. More fiber means more good bugs in your gut. Good bugs in your gut leads to better health outcomes, regardless of whether it's heart disease, MS, diabetes, heart disease. It doesn't matter. These are the simple messages that we need to just convey to our communities, that just increasing the amount of fiber on your plate is not only going to lead to better microbiome, but guess what? You're no longer going to be constipated. And that's funny, because that's one of the first things that when patients come to see me, I've had on more than one occasion, after 2 weeks, patient comes back for their first follow-up visit, and I've received a hug at the door. Dr. Stancic, I've been constipated for 25 years, and I'm finally having bowel movements every day. I know that sounds crazy and silly. Nobody wants to talk about poop, but it makes a big difference in the quality of life of individuals. And that's one of the questions, one of the first questions I ask when I first see a patient is, tell me about your bowel movements, because that tells me everything. If you're having a bowel movement every 2 days, I know. I know that you are largely consuming a fiber deficient diet. And if we just start there, let's get more fiber on your plate, that already is going to make a big difference. So, I think when it comes to diet, and I know what you're saying, there's so many different conflicting messages. Like, do I have to do this? Do I have to do that? There's even stuff on the internet about you can't eat these fruits or you can't eat these vegetables. There's a whole thing about nightshades, and all of that is silly. It's not scientific, and it's not. We should all be eating as many plants and variety, and choose the ones you love and consume them regularly. Be adventurous and try ones you've never tried before, and revisit those that maybe you didn't like when you were a kid, but you're now willing to try again. Maybe it was the way it was prepared. Maybe you had a bad experience, but don't limit yourself. I think there's so many different plants that are available to us. There are so many wonderful ethnic, dishes that are exciting and delicious. I think there's this misrepresentation, or this idea by many, that eating this way is carrot sticks and celery sticks on a dish, and you're going to be miserable and you're not going to enjoy eating. Are you kidding me? This is really exciting. There's so many wonderful recipes out there. There's so many young chefs who are so creative, who really redefine dishes that maybe were traditionally our favorites as kids, and we can revisit them, but with a plant flair to them. And also, I think it's important for us to be true to our roots. And by that, I mean that we come from all different parts of the world. Like I'm Cuban, I was born in Cuba. So there are a lot of the flavors that I enjoy, flavors like, like I certainly love beans, but spices like cumin or herbs like cilantro, which are, part of my culture. That plant-based is not just one realm, that all cultures have plant-based really at their foundation. And many of the peasant dishes in our cultures are plant-based. And so revisiting what is part of who we are, what our great-grandmother made, bringing those dishes back into our lives, and even taking dishes that maybe have animal sources in it, how could we substitute some of those and add in some plants, or make that dish healthier, but still keeping that ethnicity, or keeping those roots, or keeping those memories of your childhood and experiences at home. Because part of lifestyle medicine, of course, is also love. Dean Ornish talks about this all the time, that love and acceptance is part of what we prescribe, right? And so I think family and culture and our ethnicity should be part of our experience as well.
It's funny because now that when you start to eat healthier, it's funny the things you do that you didn't even think about before. I mean, now it's like, I don't think anything about adding a salad at breakfast. I mean, adding broccoli sprouts, of all things. I never thought I'd be eating broccoli sprouts. I used to take the alfalfa sprouts off of the sandwich. Now it's like, oh, just pile it on, and it's really good. It's good stuff. It's crazy.
I just had breakfast with a friend last week, and she ordered broccoli at breakfast. I was a little bit, I'm like, okay, she's obviously a very good plant-based, healthy young lady, but I never seen anybody order broccoli for breakfast, but it worked for her, and she liked it.
You realize how good it is for you, and the prevention aspect of it, and suddenly you're like, you're right about keeping it simple and just adding healthy stuff, and stop worrying about all of the other stuff that, all those other things.
And do this and don't do that.
Don't be restrictive.
Yeah, don't be restrictive. Act with joy and love, and don't feel like anything you're doing wrong. What can you do today to make a small change that favors what we're talking about, these general themes? More fiber on our plate. What can I do to move a bit more? Maybe instead of in your office space, instead of going to the bathroom that's right across your office, go to the one upstairs. Go up a flight, and that means you have to climb a flight, and then you have to come back down. Any opportunity you can to get in some movement in your life, maybe schedule a Zoom meeting, but standing up. Okay. Find opportunities to create some space for change in your life. I always say to patients, every little step that you take is just like it's like your 401k, right? You're dropping in just another little bit that's going to serve that personal health outcome, because that's what we want to do. Every action that we take that serves this idea that we're going to prevent that Alzheimer's disease, we're going to prevent that breast cancer, we're going to prevent that heart disease. Every action that you take is going to serve to increase the likelihood that we can reduce those bad outcomes.
Right. I want to dive in a little bit to Code Blue, and I just want to talk about it and the fact that first it was awesome and it was very empowering, and I love your story. And I want to talk about what it was like to actually, not only did you change roles before being a patient, from a doctor to, but now you're producing a film. So what was that like?
It was like driving with a blindfold. It was certainly not my wheelhouse. It was a lot of learning and asking questions, and of course it was a team of us. But we had a goal in mind, and that was to, again, why a documentary? How did this even come to be? It was always, what could we do to bring attention to this idea of lifestyle being so powerful? So I had the practice I opened the lectures, I was writing articles, I was teaching medical students, like continuing to, what other medium could I use to spread the word?
Mm-hmm.
And I had seen so many patients who had come to me and said, I saw Forks Over Knives and it changed everything.
Yeah.
I used to hear that once a week. And in fact, when patients used to come to see me, part of their homework after their first visit was I would give them, I would lend them a copy. Although I have to tell you, when you lend people things, there's a good chance you're not going to get it back.
Right. Hopefully they're sharing it around.
Right. I would lend them a copy of, I think at some point I ordered like 20 copies of Forks Over Knives. I kept them in my office.
Oh, wow.
And I would give them to the patients when they came in. And I said, part of your homework is watch this film. And I did that because so many patients would come in and say, I saw that film and it changed everything. And I saw how powerful film could be, and what a powerful vehicle could be to convey messages. So that was largely why we decided to go ahead but it was even raising money to make the film.
Yeah.
I think we raised like $200,000, and how do I do that? Like, how do I, and learning how to do that, reaching out to individuals and helping. And we had so many wonderful people who supported us, and volunteers who gave up their time to make the film. And it was a labor of love. And really it's, my hope is that it resonates with audiences, and little by little it trickles, and more people see it, and hopefully we'll get to a point where we can be recognized like a film like Forks Over Knives. I think Forks Over Knives was did a tremendous service for our community. And it's not just our country. I mean, Forks Over Knives has been translated into, I think, just about every language, and it's all over the world. And I think we're all working together to bring sweeping global change, because it's really, again, we're talking about our country. We talked about diabetes rates and chronic disease rates in our country, but this is not a US problem alone. This is a global problem. The WHO refers to this as the non-communicable diseases, but they're a problem across the country. I mean, smoking, big problem I mean, in our country, we've done a lot of good work in regards to smoking cessation programs, where I think the most recent numbers were down to 13.7% of Americans smoking. That's still 13.7% too many. But at one point, we were at 40+% that were smoking in the 1950s and 60s. So we have work to do, but I think that we are in a different place today than we were 5 years ago,
right.
Where I know that when I was talking about this to colleagues in mainstream medicine, I can see their eyes rolling back, and what are you talking about? People aren't going to change. People like their cheeseburgers and they're not going to give them up. That's not true.
Right.
People want to feel well. People want to have good quality of life at the end of the day. Yes, of course, on occasion you'll come across the person that says, I'm going to eat this way, even if it means I'll die at 45, at least I'm going to die with my cigar and my cheeseburger, until they actually have the heart attack. And then they're like, oh.
You're so right. You're so right. I've talked about that in the past. It's like, which is so important right now. It's like, why do we wait till something bad happens? Why do we wait till we have a pandemic to realize the importance of prevention? It's so true. Well, you worked with some awesome people in the film, and it is so wild, the people that you've met along the way. And have any of them mentored you along the way in your plant-based journey?
Oh, I think all of them have been important mentors and individuals that I highly admire. Certainly, Dr. Ornish, who wrote the foreword for my book, is someone that I hold in the highest esteem. Dr. Esselstyn, and not just Dr. Esselstyn, but his entire family. I don't know.
They're great. Yes.
If you had an opportunity to meet the entire Esselstyn family, and they have a foundation that they recently started, a nonprofit that is working to deliver this message around the world. And I think that's a great cause to donate to. Their mission. Dr. Esselstyn, his wife, his daughter, Jane Esselstyn, his sons, all of them, Rip Esselstyn, who he does a conference every year called Plant Stock, which is a fantastic conference I've had the great honor of speaking at over several years. This year we did it regrettably virtually because of the pandemic, but it was still just as powerful. The entire Esselstyn family is amazing. Dr. David Katz, who is just an incredibly powerful speaker. His books are, I don't know if you've ever read anything Dr. Katz has written, but he's just an eloquent speaker. I would highly advise that you read anything that, any of his books, or watch him on YouTube, or if you have the opportunity of hearing him speak live. These are all fantastic individuals. Dr. Colin Campbell, of course, who wrote the China study, who conducted the China study and wrote the book. These are all wonderful individuals who have really moved the ball of field and have done such important work. And it's incredibly important that we continue to bring more and more to, and again, as our voices coalesce, we will become the majority. And that's where once our voices are heard, that's where we really can create change in policy and change in curricula, which I think is, and again, sweeping change, not just individuals like Dr. Jennifer Trilk at USC, but that there's a standard that all medical schools require this. I think when we get there, that's a big win.
Yeah. Well, so not only did you have the film, now you're releasing a book. And when is your book out?
So the book is set to release on January 12th. 2021. So it's almost a blessing that we're releasing it next year, because 2020 has been such a traumatic year in that, it's really been defined by this pandemic, regrettably. So January 12th, I'm hoping that in this coming year is, we turn the page onto a new chapter. And I also, we talked about this in the beginning, I do hope that the silver lining of this pandemic is that it urges change now. I call it ushering in the era of salutogenesis. I think now more than ever, it was important 2 years ago, it was important 10 years ago, it's really important now. I think this is an important time for us to act, and hopefully the book will serve not only to create change on an individual basis. So I hope the book acts as a handbook or a roadmap for the individual who how do I do this for myself? In a very simple fashion. The book is not, I wanted the book to be a simple and honest conversation between myself and the reader, as if we were just in a room together and I shared my thoughts. I wanted it to be that way. But also speaking to the evidence, because it's important for me to make this point. It's not my subjective opinion. This is based on objective evidence in the literature. And also, I named the book What's Missing from Medicine, because this is what I didn't get in medical school. After 10 years of medical education, of training, it was 4 years of medical school, 4 years of internal medicine residency, and then another 2 as a subspecialist. That was a decade of my life dedicated to higher education in the field of medicine, and I didn't learn this. So I would love this book to be part of every medical student's backpack. And I would love the book to be of interest to anyone who wants to implement changes in their own life. But again, with a respectful understanding that we're going to go at your pace. We're going to go at what's reasonable for you, and know that if you regress in any way, that's okay. You may take 2 steps forward and then a step back, but the idea is that the net is that we're moving forward. And I think sometimes we're very hard on ourselves. If we do well for a week and then we make a mistake or step back, we give up. And that's not what this is. And this is, by the way, not something we do for 6 months to get into a wedding dress, or this is lifestyle. This is not about weight loss. The great thing about this lifestyle is the side effect is weight loss. So I think particularly as women, we, at least my generation, we've been focused on the right number on the scale, or, you know, measuring calories, or counting calories and measuring how much food. I want that to go all out the window. It's not about depriving ourselves, eating less, consuming less calories. So the wonderful thing about plant-based nutrition is that we can eat voluminous plates, right? Because these are foods that are nutrient dense but calorically deficient. So we can feel satiated. And I think that's a very big distinction from what we were large. And again, I'm speaking to my generation, where we grew up with, you know, the skinny jeans, the Jordache jeans, and the Tab and the Diet Coke, and 100-calorie packs of food, processed foods. That's the way we learned how to lose weight and how to maintain the right number on the scale. Listen, the right number on the scale is not what this is about. This is about implementing and employing daily optimal lifestyle behaviors so that you're going to get to the right weight, but you're also going to engage in behaviors that are going to allow you to age gracefully, free of chronic disease. That's really, I want to reset our goals, particularly as women, to eat and to engage in lifestyles that are going to allow us to live our best life, our best existence, that we all live to our greatest potential. And it's not about the number on the scale. It's about our wellness and how good we feel each and every day.
Right. You were so right. And researching for your book and gathering all this evidence, was there anything that surprised you that you weren't expecting to find when you were writing your book?
Well, you know, I had never written a book before, so I can tell you that the whole process was exhausting and humbling. But, you know, I had a wonderful publisher, the president of the publishing house. His name is Randy Davila. And he knew that I had a powerful message to share, and also knew that I was a novice in this respect, in that, I mean, certainly I had written chapters for books, scientific books, which is very different than writing a book for the general public. So learning how to use terminology that would be understood and received by the general public, learning how to balance that, but still being clear about the science. So it was about balancing those two respects. But just, I had such a wonderful team at the publishing house that was so supportive and helped me to work through those challenges, those obstacles. I think at the end of the day, I'm really proud of the book. I think it reflects who I am, which, by the way, is, I'm a very simple person. It's about speaking to the facts. And also, I try to introduce this wherever I can throughout the book, in that we're all human. We're going to make mistakes. You don't have to be perfect. And again, that overarching understanding that you must go at your own pace, what works for you, and this idea that we must be kind to ourselves above all else. I think we tend to be so hard on ourselves, and when we release that, I think there's, again, more space for creativity and for implementing these behavior modifications that can at times, when first we meet up with them, can feel daunting.
So being a patient yourself, going through what you've gone through, how has this changed the way that you deliver care and practice medicine? I mean, I know for me, going through what I went through just with pain and stuff, I feel like I'm a more empathetic practitioner. I'm more willing to listen. I'm more, you know, compassionate. So how has your experience changed you as a physician?
Yeah, well, I think, first of all, being the patient in the bed, right, feeling very vulnerable, because when I was admitted to the hospital, I knew all the doctors, the nurses, the residents, they were my students, and so it was feeling very vulnerable, and seeing the perspective. When you make rounds and you go into a hospital room and you're talking about the patient as if they weren't in the room, all of a sudden I was that patient that everyone was talking about, and so understanding that, wow, that doesn't feel good. And moving forward, this is something that I'm going to modify and teach my students and residents, that the way you engage the patient and what you're talking about in the presence of the patient, think about that, how it would feel if you were in the room and people were talking about you as if you weren't in the room.
Right.
So those things were quick and important lessons that I learned early on. But yes, moving forward, this idea of what we traditionally see in medicine, these 15-minute, 20-minute visits and I just recently, I had a physical exam, and the physician the entire time had his back to me as he typed in information into the computer. And that's regrettable. That's what and again, the reason that he's doing that, not because he's disrespectful, that's the world that we have to practice in, because of this healthcare system that we've created, where we have to see 30 patients in a day, and we have these EMRs that require so much of our time, and so you're trying to do that and care for the patient. So there's a lot that we have to do to address issues in healthcare and redefine how we're going to move forward. But certainly you can't be empathetic and compassionate and listen to patients when you have to type in a million things into an EMR. So I've stepped out of that world. I no longer practice medicine that way. And by the way, part of what I'd like to do as I move forward is be at that table where we bring together leaders in healthcare about how we can do this better. Bringing together CEOs of insurance companies and deans of medical schools, and even the pharmaceutical industry, anyone, policymakers, politics, whoever needs to be part of that discussion, but bringing these stakeholders into a room to talk about, these are the lapses, this is what we're doing in medicine that isn't beneficial to the mission, and how could we do it better? And I think there is a growing understanding that healthcare can be done better. So now it's the final exercise that we need to implement is, who are these, do we have brave and courageous pioneers that are willing to be part of that discussion, and who will that be? And I think that there are people in this country that are getting ready to make important changes. And when that happens, it's going to be really exciting, because we can create a model that really works not only for the healthcare system and the physician, but most importantly, to serve the betterment of that patient.
I think you're right. And the more that patients connect with their practitioner, provider, I think the more compliant they're going to be, and the more excited about lifestyle change they're going to be. It's like, hey, I showed up, look what I've done. And it's just going to be a lot better relationship.
It has to be that relationship of trust, right? And it's hard to build that relationship of trust in 10, 15 minutes.
Exactly. Right.
Creating that trust, because we're asking patients to do things that are not part of their realm, and helping them change is always hard. We're used to certain, and my average patient is in their 4th or 5th decade of life, so they've been doing what they've been doing for a long, long time. And all of a sudden, we're asking them to, it's like you've been right-handed your whole life, and now I'm asking you to write, 13 page or whatever, 40 page essay with your left hand. So it's hard. But guess what? As you continue to exercise that muscle, it becomes more and more accepting, and all of a sudden it becomes a norm for you. So I think that creating that relationship of trust is incredibly important, and I think that's another aspect of lifestyle medicine that is so becoming to me, is getting to know the patient, getting to know about their family, really. And here's another difference that I think is important, that is somewhat a metamorphosis from what is traditional medicine, in that I think in the past it's been like doctor patient, and the doctor is telling you this is what you need to do. It's almost like directives that we give patients, right? Lifestyle medicine and the future of medicine, I think, must be a partnership between the doctor and, or again, the healthcare professional and the patient, in that we're going to work together. My job is to give you the support and the evidence and help you understand this path versus that path. Because ultimately, if I see a diabetic and they want to be on the medication and they don't want to explore a lifestyle modification, then I have to respect that. Right. So, but every time I see that patient, regardless of the prescription that I'm writing them, I'm always going to introduce prevention or the idea of disease reversal. So that's the trans-theoretical model of change that we're constantly assessing. Every time we see a patient, we're assessing their readiness. And when we see a window, that's when we step in. So, but again, it's constantly having that conversation. Are you willing to expand beyond? And sometimes there may be a big stop sign there and you respect that. But when you least expected, I've had this happen where I've had patients that have clearly been, there's no way I'm going to change anything. Thank you very much, but just give me my metformin. Right. And then someday they call me up and they say, Doc, I want to schedule an appointment. I want to talk a little bit about that lifestyle thing that you mentioned in the past. Yeah. I think I might be ready. So then we excitedly invite them to have the conversation, and that's often, and the wonderful thing about lifestyle medicine and plant-based nutrition is that it has this, and I'm using this as I'm an infectious disease doctor, but it has this infectious quality, right? Because once we start and we start to see these benefits, we start to see, we mentioned, oh, I don't have constipation anymore. I'm sleeping better. I have more energy. My cholesterol level, what? It dropped 50 points since last time. All of these bright little aspects are become evident, and patients, they get excited. And then they want more. Like, what else can I do? How else can I fine tune what I'm doing? And then all of a sudden I get a phone call that says, my mom wants to see you, Dr. Stancic, or my cousin saw that I lost weight and I feel so good. She wants to. So I often have in my practice patients, entire family that I end up seeing, because that's so cool. There's this infectious quality to it. Like I want a little bit of that, you know?
Right.
And that's a wonderful thing.
Well, how has MS changed your outlook on life?
I say this, it's funny. I think that MS at the time just felt like the end of the world. But honestly, I believe that MS was the greatest thing that ever happened to me, because it brought this awakening to me. I think that if I hadn't been diagnosed with multiple sclerosis, I don't know where I'd be today. I might be an obese, fatigued, depressed, burnt out physician. Yes, with that said, there was a lot of pain and suffering that I experienced. And as I said, I'm not cured of the disease, but it has certainly brought this level of understanding that I would not have had otherwise. And importantly, it's allowed me to serve as mentor to other students and physicians and residents, which I hope will then lead to them acting as, so I see this as this exponential opportunity to affect not only what's happened in my own life and in my own community and in my own world, but through my book and my film and my relationships with in my own life, that my message will continue to spread across the country and even affect people that I've never met. Through one of my ex-medical students who now practices in California and is affecting a woman who's living with MS in Los Angeles. And somehow indirectly, I had something to do with that. That is, oh, I get goosebumps just thinking about it.
Yeah, that is so cool. And it just really, it brings a lot of hope to people it's just with any disease, honestly, it just brings a lot of hope because it can be so depressing. So it's great to hear that there's something you can do except for just, take it and take the medicine and just, continue on your life like that. There is hope. That is so good. Well, is there anything else I should have asked you? Anything you think is important that we didn't cover that you want people to know?
No, I think we really went through this comprehensively. I thank you for the opportunity to share the film and the book. I really believe that we're on the precipice of something really exciting. I think that healthcare and the experience for medical students and healthcare professionals in professional schools will change in the next decade. It's already happening.
Mm-hmm.
And I think that 20 years from now, when you go see a physician, the experience is going to be much different than it is today. And I think it's largely because of the work that so many are doing in our lifestyle medicine space that is going to lead to that. I want to definitely plug the American College of Lifestyle Medicine and the executive director there. I mentioned her at the beginning of our conversation, Susan Beniguez, who has done really extraordinary work in expanding the message. Lifestyle medicine is not just in the United States. There's a Brazilian lifestyle medicine, there's European lifestyle medicine, there's Korean lifestyle medicine conferences that are happening all over the world. So this is not just a message that resonates with us, it resonates with the world. And I hope the film and the book similarly reach many folks around the globe. And I'm really just blessed and grateful that today, and by the way, October 11th, I don't know if I mentioned this, but October 11th, this coming October 11th, it will be 25 years since I was diagnosed and admitted. I was admitted on October 11th and told I had multiple sclerosis. So it's going to be 25 years this October 11th. And on that day, I'm going to celebrate or commemorate that day by walking 25 miles here in my community. And I've invited my family, friends, and patients to join me for whatever they want to do. And but the fact that here I am, 25 years, where I was told I'd be in a wheelchair, and I'm running and walking and feeling so inspired, medication-free. I'm truly blessed, and will continue to my last breath. Sharing this important message with, as I said, whoever's willing to hear it, in hopes that it will inspire them to create change in their own lives.
So 25 years, just for people who don't really realize, know much about MS, the thought is, or, the progression of the disease is that within 10 to 20 years, you will most likely be in a wheelchair. Yeah. So for you to be at that 25-year mark is huge.
It truly is. It truly is. And as I said, I'm incredibly blessed. So I will be celebrating. And I know we don't live in the same part of the country, but I would ask you this: if maybe on October 11th, which is a Sunday, I want you to keep me in mind, and maybe you can go for a short walk and celebrate with me.
Yeah, I will for sure do that. Well, where can everybody learn more about you, connect with you, find the film, find the book?
Yeah. So the website for the film is codebluedoc.com. So it's CODEBLUEDOC. So doc is for doctor, documentary, double entendre.com. If you go to that website, you'll see there's several platforms, including like Amazon, Apple TV, Vimeo, so Vudu, whatever platform you'd like to use. So you can either rent or buy the film. Some people are still old-fashioned and still want the DVD, so we have DVDs available. Then the book is on Amazon right now for pre-order, so I'm excited to have that now available. It will be released on January 12th. My website is drstancic.com, so it's drstancic.com, and you'll find a link to the book there as well.
Yeah, I'm looking forward to your book. I think I love the movie, and I'm definitely going to post more about it so everybody knows. I think I watched it on Amazon, so it was super easy to get access to it. Well, I think you've kind of already covered everything. I was going to ask you last what the impact you want to have on the world with your work is, but you've kind of probably covered it all. It's just,
yeah. I want to make this idea of lifestyle, the what first comes to mind, or this idea of, in the field of medicine, this idea of salutogenesis to be the primary initiative. I want to create that shift, that if we can create that shift in paradigm where for the healthcare professional, maintaining health is our primary initiative, I think we've come a long way. I think that will change the world. I really do.
Yeah. Thank you so much for talking to me today. I really appreciate it. Thank you for all the awareness that you're bringing and just really all that you've done and that you continue to do.
Thank you so much. And I similarly want to thank you for all the work that you do. And I hope your podcast grows and get some of these folks that I mentioned to you. Like, I would love you to interview Dr. Trilk, and I know she would be so happy to be part of it, and she can share her perspective of the important work she's done at Greenbelt. And definitely, you're in St. Louis, and you know Karen Dugan. Reach out to Susan Benegas, who is just these are extraordinary women, and we want to share their important work.
Yeah, well, I'm definitely I might ask you for the information in an email so I can connect with them. That'd be great. I would love to talk to them.
Sure.
That sounds great. All right. Thank you so much.
Bye-bye.
Take care. Bye.